I think you have to look at patient-specific variables. For example, you have to look if they've ever had a history of renal problems, because non-steroidals can reduce renal blood flow. You have to certainly be concerned about their stomach. Have they had a history of irritation in the stomach from taking a non-steroidal, such as Motrin or Proxen or whatever? You can see gastritis, you can see all the way up to peptic ulcer disease caused by a non-steroidal. Taking it to its worst extreme, you can see gastrointestinal bleeding, which causes about 16,000 fatalities a year. So you certainly have to be mindful. I think the most important thing, even before you get to that, is does this patient really need a non-steroidal? These are anti-inflammatory drugs, and if the pain is not inflammatory in nature, perhaps acetaminophen would be sufficient, or maybe you need a coanalgesic, or perhaps you even need to move on to an opioid. So first, making sure the patient is even a candidate for that group of medications. Then, of course, looking at the renal issue, looking at the gastrointestinal issue, and last, we also have to worry now about non-steroidals increasing the risk for a heart attack or a stroke. So there are strategies that you can take. For example, naproxen is probably the non-steroidal least likely to increase the heart attack and stroke risk. If you're worried about the stomach, certainly you could add on a drug like a proton pump inhibitor or misoprostol, which is going to decrease the impact. And a drug like celecoxib, Celebrex, is a COX-2 selective inhibitor, so that will probably, at least initially, will be a little safer for the stomach than a non-selective drug. So I think you have to look at all of those variables.